The next topic in our breast cancer series is male breast cancer. Yes, that's right. Men can get breast cancer, and it is about 1% of the total for all breast cancers. And there have been some notable individuals with male breast cancer. If you're around my age, you might remember the announcer for The Price is Right. His name was Rod Roddy. Well, Rod Roddy had breast cancer and he also had colon cancer. You might recognize Peter Criss. He's the original drummer of Kiss. He also had breast cancer. Richard Roundtree, the actor that played Shaft, you may be familiar with that if you're my age or a little bit older. He also had breast cancer. Edward Brooke was the first black American elected to the U.S. Senate from Massachusetts. Now, this disease can affect young or old, but typically it's about a 60-year-old male presenting with nipple discharge or a mass in the central part of the breast, a lot of times under the nipple. And the reason why that is because if you go back and watch my original breast cancer videos talking about how it arises, it's usually ductal epithelium. And that's the only part of the male breast where there's good ductal epithelium. And so typically the mass is right there in the center. So again, you can get pain, a mass, nipple discharge, or retraction of the nipple where it kind of pulls inward. When that happens, you have to at least get it investigated. So this one can have a genetic association. There's a gene called BRCA2, which is most common, but you can also see it with BRCA1. The approach to treatment is similar as with female breast cancer. Um, and these folks have a similar kind of survival. They do pretty well. Of the four guys that I mentioned there, three of them actually did fine, essentially cure. Rod Roddy did not survive. He also had colon cancer. Now, as with anything, I think that when you have something so rare like male breast cancer, the moral of the story is to just be familiar with your body, be familiar with lumps and bumps, any changes you have, not just with breast tissue, but anywhere on the body. And it's important to note that you can have a lump or a bump and it be something benign like a lipoma or an epidermal inclusion cyst. But if you are of age, if there are the symptoms like I had mentioned, you have to at least consider it and not let it go too long because, like breast cancer in females, it can metastasize.